So we are live. Testing. All right, good evening. Thank you all for joining us this evening. Us doing a Facebook Live in the first part of August certainly means that school is near for us. So our goal tonight is to update on some operational things, some academic things, some communication things, as well as give some COVID protocol updates for our public as well. There will be an opportunity towards the end of our live session here to answer some questions, and we'll try to dive through any of those questions, both that have been submitted through our email at the end of last week, and then anything that might come through the live session today. Certainly appreciate some of our students that have joined us today to help put on this production. Miss Audrey Young, Miss Sadie Quick, Mr. Bradford Young, who is one of our teachers here at Mountain Home High School. A community member, Miss Heather Loftus, is going to help us with moderating it, and Dr. Brian Malty is going to be here with us from Baxter Regional Medical Center to help answer some questions from a medical perspective. And so the first day of school is August 18th, and so that's just certainly about a week and a half away, and so we're looking forward to that. Our teachers do report. Of course, many of them have been working all summer long and getting ready for the upcoming school year, and Dr. Nail, she's going to talk about some of that. But we do have open house from 1 to 7 p.m. on August 12th, and that open house will follow many of the same procedures by schedule that we had last year. So that will be by appointment and then also by advisor as well. Our district communications person, Miss Jennifer Siemens, going to talk to us about some exciting things that we have going in communications. Dr. Dana Brown, our assistant superintendent for career and technical education and federal programs, is going to give some updates on CTE and pathways. And then Dr. Caroline Nail is going to talk about some district academics. After they present some information and give you all some information, we're going to go through our COVID protocols and then some question and answers. So I'm going to start now by turning the mic over to Dr. Brian Malty and Ms. Heather Loftus with KTLO to ask some questions. So Dr. Malty.
Yeah.
Dr. Malty, thank you for joining us tonight. Of course, Dr. Brian Malty, pulmonologist at Baxter Regional Medical Center. We are very sensitive of your time. We know how busy you are, so we truly appreciate you giving us this opportunity tonight.
That's all right. Thank you for having me. I think it's one thing to note, though. I'm not officially here under the banner of Baxter Regional. My visit here is mainly out of my opinion about what we can do to help curb the virus.
You're also a parent of 3 little bombers.
Yes, that's correct.
Dr. Malty, first question, what are you seeing in the Delta variant that is different than what we dealt with last year?
Yeah, so what we're seeing right now, and I can say from the hospital experiences, we're seeing a lot more secondary infections, more than what we had during the previous wave. From July, when we first had our case here at Baxter, up until sometime around April, I would say probably we only had a total of 9% infection rate for the whole of Arkansas. Just within the last month alone, our numbers increased by 3%. So that's a huge increase, which means the variant is really more transmissible than the previous variant. The other thing is we're starting to see younger patients get sick from this. We've had patients in their 20s, 30s on the ventilator. Just last weekend, we had to put one on the ventilator. He was in his mid-40s. Really sick, no comorbidities to speak of with these patients. Majority are not vaccinated, unfortunately. I would say probably 90% of the whole population of the hospitalized at Baxter since March have not been vaccinated. So we're actually seeing sicker patients now more than ever. We had to transport one patient who was in his early 30s under ECMO. It's a highly specialized mode of bypass to oxygenate the blood. Unfortunately, that's not something we can continue here. We can get it started here, but we have to transport them out of state.
What can parents do to prepare for the upcoming school year?
Right. That's a load of, question, because I know every parent will have difference of opinion. We know that the state has made a law against mask mandates. However, having said that, I would strongly encourage parents to reconsider masking, or if they notice any illness in their children, to have themselves tested for COVID before sending them to school. I think that's going to curb the number of cases we're going to have here. We already know in Marin County school system alone, there's about 200 cases. That's not something we want to, duplicate here at Mountain Home for sure. So if you can encourage your students to wear a mask, that would help. But if you can't let them do that, or it's against your, opinion, I would at least say, if you can monitor their symptoms, if they're having any new symptoms, don't bring them to school, have them tested immediately.
How can parents help our school to keep kids safe and minimize positive cases and quarantine numbers?
The number one, I would say to that, and a lot of people will be against me, is vaccination. If you're vaccinated, you're less likely to get sick. The other thing is, if you're not sick, then you can bring your kids to school. If both parents are sick, there's no way you can bring your kids to school. Who's going to take care of your kids? That's the number one thing I wish some of our patients could come here and talk to you about. I can tell you, for the patients in their 30s that have come here with their children as young as 3 years old, they would tell me at the brink of admission, being breathless, they would say, "I wish I were vaccinated." And then in the end, they end up on the ventilator, and I tell their wives, it's just something that we have to work with. If they make it, good. If they don't survive this, then the problem is who's going to take care of their children, being the breadwinner of the family, at least for the patients that I've seen. That's going to be terrible for the kids. So one thing I would say is, if you can get vaccinated, go ahead and do it. If you can't, at least take every precaution not to transmit or carry the virus. So if you can go out, meet with family, go to areas of worship, I would say try to wear a mask if you can.
Dr. Malte, you mentioned you strongly encourage the use of masks. Is it dangerous for kids to wear masks?
It's not dangerous to wear masks for children. I have a kid as young as 5 years of age, and she knows the only way to get out of the house is to wear a mask. So she's pretty much used to it. It's just a matter of encouraging them to see the benefit of using a mask. People would say, will that carry bacteria? Well, they certainly probably can if they're soiled, meaning if they're moist. The obvious thing is, if they're moist, you go ahead and change it. That's the same thing with healthcare. We wear our masks, we wear N95, and if an N95 is soiled, you don't reuse it. We take a new one and use it. So same thing with children. If their masks are soiled because of moisture, all they need to do is just replace it with a new mask.
Dr. Malte, do you have any other comments you would like to make tonight?
Right. So one thing I would say is, I appreciate Dr. Long and his group. Last year we were able to bring our children to school. I was not afraid at all to bring my children to school. My wife probably was. But we have done a remarkable thing last year, meaning keeping kids in school. I have had friends from all over the United States. They've not been able to send their kids to school because the school system were shut down pretty much. But for some reason, we were able to make it. And I hope we can do the same thing this year without having any increased cases. One thing I would say is, the Children's Hospital has been getting full. And we at Baxter have had a little bit of discussion about having to take care of these children to stabilize them before they get to Children's. Because just think of it this way. If your kids get sick, hopefully not, they're going to end up under our care. We are not a children's hospital by any means. That's not something I wish we would need to do, but it's going to be a gamble if you send your kids under our care. And obviously, we'll do whatever we can. We were lucky enough last year, sometime around September, we had a child in his early to mid-teens that developed myocarditis. I was called in by the ER physician to help stabilize the patient. Fortunately, that patient survived. But like I said, if you can keep your kids healthy, we don't want to run the hospitals full of children. You know, that's something that nobody ever wants to see.
Dr. Malti, thank you for your time tonight, and most importantly, thank you for everything you've done for our community.
Thank you. I appreciate you inviting me.
So to talk now, of course, one of the things that we received from our public last year was the desire to know fully what's happening within our schools. And so much of that was generated by Miss Jennifer Seaman, our communications coordinator. And so we know how important it is for our parents and our public to know what's going on in the schools. So Miss Jennifer is going to talk to everybody about some of those things that we're going to continue to do.
Good evening. Thank you for having me here tonight. Well, one thing I'm really excited about as we go into this challenging school year is that we are going to have a new communication system, which will include a new website for our school district, an updated website, and that will also have an intuitive app that goes with it. So that app will be available to all our families and community members to download, and on that app you will be able to see anything that is on our website. Also, things that we post on our social media will be there in a feed on the app. So the app's going to have some pretty neat features. One thing that I think is pretty cool is that it's going to have push notifications for different groups, different, let's say, boys baseball. So you'll be able to, if you are interested in boys baseball, you'd be able to join or follow a push notification that would allow you to get any updates about boys baseball. So this could include, let's say, maybe a location change. So we're going to Greenwood to play baseball, but we're going to need to change fields. And if that happens, you can get a push notification through this app that will tell you that. So you won't have to check social media. It will come directly to you. And in that push notification, when it changes the location, it will also allow you to click on that location, and you'll be able to, that will then open your Google Maps or whichever map app you use on your phone, and will give you turn-by-turn directions to that location. So that's a pretty neat feature that we'll have on this app. The app should be the website and the app, the whole system, which will also include a parent communication system, much like what we do now. In fact, we sent you all an alert call today about our Bridges program. So our new system will also have a parent communication tool that should roll out by the first day of school. So we're looking for that, and when it does, I'll have a whole communication package that goes out with it. So you will all have the information about how to get that app and any tutorials for our website. I wanted to report also today a little bit about the cases of COVID-19 that we've had over the summer. So in the month of July, we had 41 positive cases in our school district, and so some of those were, a majority of those were outside of school, obviously, because we were not in school in July, and then some were found to be positive and involved in school activities in the summertime. So with that, we had 32 close contacts that were identified. And again, some of those were from in-school contact with one another, and some were from outside of school. And so far in August, we've had 12 positive cases and 6 close contacts identified. Moving forward, we intend to continue our system of notifying families when there is a positive case in their child's school building. So if you have a child at the junior high and we had positive case at the junior high that day, you will receive either a text message or an email, depending on how you've signed up for parent alerts. You'll receive that information just like you did this year. That will also go on our social media, and on our new website we'll still have a Ready for Learning page, and that information will be logged there daily as well once school starts. Between now and when school starts, we're posting on Fridays to give you that information. And also, and this is Dr. Long's initiative and his commitment to you all, but I am looking forward to him continuing to update you weekly in some form. So he will either send you an email weekly, or there may be an occasion where we have a video or maybe another live event as his communication tool for the week. But I appreciate his commitment to communicating with you all each week to kind of give you an update of what's going on, not only with COVID-19, because I know it's hard to remember that we had just regular school before we had COVID-19. And so he will give you not only updates on COVID-19, but also updates on the fantastic and wonderful things going on in the school district. I hope everyone has a great year. Thank you.
All right, next up to give you some updates on the upcoming school year and to echo what Ms. Seaman just said is that, you know, our educators have been working so hard all summer long to plan a very engaging and rigorous school year. And so while we are dealing with a variety of outside voices in regards to, you know, the pandemic and our current surge in cases, you know, we're very excited about the learning opportunities that are before all of our kids coming up. So Dr. Dana Brown's going to update on some things career and technical education related, as well as pathways.
Good evening. I'm excited to be with you tonight to talk about different initiatives that we are working through in the areas of career and technical education. Just to give you a little background, since 2001, our high school has been a wall-to-wall career academy model high school, which provides our students with a variety of real-world learning opportunities within our community. Over the years, we have found that there is a need for a better understanding of what career-connected learning means in grades K through 12. It's with that realization in mind that our district has developed a Pathways Task Force. This task force has been working throughout the last year to lay a foundation and an understanding of what pathways through career-connected learning look like. So it's important for us to be able to speak a common language. So tonight I want to share with you a glimpse of what our teachers will be focusing on through our Pathways initiative over this next year. So when we talk about pathways, what are we talking about? It's a journey to develop a career and life readiness through career-connected learning opportunities that will help our students to connect to real-world experiences by developing a knowledge and skill base that's needed to successfully enter the adult world of work through careers and community opportunities. So it's through those lenses of the career-connected learning opportunities that students will gain a better understanding through the pathways by focusing on specific skills by grade level. So let's go with K through 5. So in grades K through 5, they're going to be focusing on career awareness. So what does that look like? Students will be understanding and looking at the concept of work, identifying current and new careers, building excitement about careers. So, for example, like whenever the safety week occurs at the kindergarten or grades K through 12, and they bring the fire truck and the fireman talks about the different safety pieces, that's an awareness. So making those connections. So in grades 6 through 7, we're going to be focusing on career exposure. So our students have the opportunity to take the Gallup Strengths Poll Inventory. So during this particular time, they're going to be learning about their strengths. They're going to be identifying personal interests. They're going to be having an awareness of self and work and becoming more engaged in the development of their future. So as we move on to grades 8 and 9, the focus and the lens through the career-connected learning opportunities will be through exploration. So students will start matching their interests and skills to careers through our career and technical education programs of study. So for example, like Agri and business. They may update their student success plans and deepen their understanding of what interests them. You know, what do I like to do? What am I interested in versus what do I want to be when I grow up? They'll also be looking at the education and training factors and employability skills. We hear a lot of times soft skills. What does it mean? You know, what are employers looking for whenever they're asking for you to be on time for work? What does that look like? So, carrying on to grades 10 through 12, you're having career experiences. So, students starting in grades 8 through 12, they are having the opportunity to engage in the career and technical student organizations, like FFA, FBLA, HOSA. And so that's one example of what a career experience could look like, and kind of ties from grades 8 through 12. So expanding into grades 8 or 10 through 12, you're going to try out career interests through those particular programs of study. There's also work-based learning opportunities, as well as internships, apprenticeships, and even students learning and being able to have industry-recognized certifications, as well as early college credits. So there's a lot of experiences. So it's our hope that with our Pathways initiative, that this will provide all of our students in grades K through 12 with a clarity and a better understanding of what career-connected learning really means. So by having career awareness, exposure, exploration, and experience, we hope to help our students make a positive transition into their life after high school, whatever that looks like, whether it's through college or on-the-job learning. So again, I hope everybody has a great year, and go Bombers.
So our career and technical education is certainly an important part of what we're doing. Dr. Caroline Nail, our Assistant Superintendent for Learning and Academic Services, is now going to give you an update on a few things as well.
Thank you, Dr. Long. Good evening. It is my honor to lead Bomber Academics here at Mountain Home, grades kindergarten through the 12th grade. My department supports our teachers so that our children receive an effective, strategic, and memorable learning experiences each day. Our teachers have been on summer break, but even during these summer months, they are still hard at work. Mountain Home Public Schools offered 68 on-site professional development sessions to ensure collaborative development and strategic implementation of our curriculum and programs for each grade level and classroom. These professional development sessions were centered around our Mountain Home Public Schools academic goals. So I'm going to tell you about a few of those. First up is our literacy programs. The Benchmark Literacy Program will be utilized through our kindergarten and 5th grade to ensure that we are supporting the science of reading. Our families will be receiving information throughout the year as our students move through the first year of implementation about these units of learning and what they will be covering. Second is Essential Standards. These trainings were led by our TOSAs and Michelle McWilliams, who assisted teachers as they selected academic standards and objectives for our students to reach the highest level of learning within that grade level and classroom. And last, but definitely not least, is Social Emotional Learning. SEL, as we like to call social emotional learning, is a process where children learn how to manage their emotions and also develop positive relationships with their peers and also their teachers and adults. Close to 100 teachers in the Mountain Home Public School attended SEL professional development sessions offered, and these were Youth Mental Health First Aid, Benchmark, and SEL resources, and the SEL and student re-engagement training at our junior high school. We know that the pandemic has been challenging for our students, our teachers, and our families. These social emotional learning sessions provide our teachers the tool to help with the transition back to the classroom and how to support our students and families. Our teachers and staff are working hard to ensure that this school year, no matter what we face and the challenges in front of us, your child will get the best learning experience each and every day. Thank you for your time and support, and as always, it's a great day to be a Bomber.
So I really do appreciate all the hard work that has gone into our teachers' learning and our teachers' own professional development this summer, the hard work that they put into pouring into our students in this upcoming year, whether we're having a spike in cases or in the middle of a pandemic or not. You know, our focus is certainly going to be on, you know, serving our kids with the very best education that possibly exists. Kind of have a funny story, so I'll take a little break and share something personal. My wife and 2-year-old was looking for, you know, our Facebook Live that's on right now, and so I get a text just a minute ago that they run across a video, and of course everybody's probably been watching, or if you haven't, been watching the Olympics, but you know, we know the name Caleb Dressel, and so my 2-year-old came across a video of Caleb Dressel, and he was sitting there being interviewed without a shirt on like the swimmers do, and my 2-year-old said, "Daddy, put your shirt on." So I really do appreciate, his confidence in me, but I wish I looked like Caleb Dressel, but I don't. And then they did find me, and so I do indeed have my shirt on. So just to talk about some of these, quarantining rules, questions. Miss Heather Loftus, she's going to go through some questions for me. And guys, I understand that the whole subject of this has been so polarizing in nature. There's so many opinions associated with it. And I want you to know that from my standpoint, I'm going to respect as many of those opinions as I possibly can. I'm going to honor your opinions. But every decision that I'm going to make with the best interests of our students, staff, and community in mind. And I know we're not all going to agree on those, but truly, there's nothing, no decision to the table or nothing, no conversation I'm not willing to have. And so, certainly going to reach out for that. So with that, Ms. Heather Loftus, anything that's come through?
All right, Dr. Long, we have several questions that have come through. I encourage you, any of our Facebook folks, to submit those questions online. We are sitting here looking at them right now, and we will ask Dr. Long as many of these questions as we can get to. Let's start with, take us back to last year. What was implemented? What did you learn that worked? And what did you learn did not work?
So one of the things that certainly did work is our protocols that went on, and I appreciate Dr. Malty talking about that because we were one of the few schools in the state of Arkansas that was able to host in-person learning all year long. And when saying that, I will say that, of course, we're all, if anybody's watching the news and you see about, Marion's experiences, that is a shock factor to that. But the reality is, last December and January, we did have some weeks in which we were quarantining 150, 200 plus students within a week. And so the difference is we were able to work through a lower number of cases at the beginning of the school year and then reach our peak. Where it does this school year, it's going to certainly seem like we're going to be entering into a high level of community spread and community transmission. So what we've done is we've pulled out those protocols. We've pulled out all the plans that we put in place last school year, and we're putting them back in place from the immediate start of the school year. The one exception to that is, the mask. And of course, we all know that per Act 1002 that we, can't mandate that. I am going to continue to strongly encourage that to go on because I do feel like, I'm no medical doctor per se, but all I know is what we did last year worked. And so as much of that we can replicate is certainly what we're going to do. So everything from seating charts to pod to physical distancing to restricting the access to the buildings, particularly at the beginning of the year whenever the spread is high, is definitely something that we're going to start the school year with.
Question that's been submitted online, just how can you socially distance when it comes to lockers, cafeterias, and most importantly, buses?
Yeah, so the buses is probably the most challenging of those because the space is limited. We did add in a few extra routes to decrease the capacity on the buses. We also, within our buses, are assigning seats, particularly with households. And so, if a group of students are going home to the house, then we're having them sit together, and that way we know that they're able to move through the family unit on buses. CDC and the Arkansas Department of Health guidelines did come out regarding buses, so they really encourage the ventilation and the circulation of air. Of course, we're going to move our kids through the pods within the classrooms. We're going to space out our desks as far as we possibly can within classrooms, utilizing our open spaces that we do have. And so I know that that's not an ideal situation, but it's one that we feel like did work. We were able to get a little bit laxed on those protocols towards the end of last year whenever the case numbers were so low, but it's one in which we're going to very come strongly at the start of this school year.
Several mentions of the Marion School District made tonight. I want to read to you from the Arkansas Democrat Gazette today. The Marion School District Thursday said 839 students and staff have quarantined. Classes began late last week because of the outbreak. The district said in a Facebook that 46 students and 10 staff have tested positive for the virus. Have we had a chance yet to learn what is being done, Marion, and what we can do to hopefully prevent that?
We haven't, but I'll go back to say what I was saying in the beginning. I do think that we know the quarantining rules, put forward by the Arkansas Department of Health are anyone that comes in close contact with a positive case, and a close contact is defined as being within 6 feet or less for a cumulative of 15 minutes or more for a 24-hour period. And so we know that the rules to that, of course, one of the rules that the Department of Health did put in is if a student has been fully vaccinated or a staff member has been fully vaccinated, then as long as they're not showing symptoms, then those rules are exempt from there. Also, we received from the Arkansas Department of Health that if both individuals, the infected and the exposed, are both wearing a mask, not just wearing a mask, but wearing a mask correctly, during that time, they are also exempt from the close quarantine. So we know that those rules exist in that, but I still do anticipate a high number of quarantine numbers as we enter into the school year, especially as we begin navigating those ways out. So remember how that worked for us last year was, a quarantine period is 14 days, unless, of course, you can produce a negative test upon after the 7th 24-hour period. And so, and then after that, then they're asked to wear a mask in doing that. So those are kind of the quarantine rules, and so I hope that I've answered that question. We have not got to study a lot about what's going on, in Marion, but certainly something that we'll look at in the next week and a half.
Lots of questions online about BVA, Bomber Virtual Academy. Will my child automatically become a Bomber Virtual Academy student if quarantined?
So that is our instructional delivery of the program is going to be a little bit different. So one of the things we did learn last year was that being able to educate students both in a seated classroom and virtually at the exact same time is a very, very difficult task, and it's a difficult ask for us to make of our teachers. And we don't feel like that it's best for either the students that are sitting there or the students that are at home to learn in that way. So what we're going to do is whenever students are quarantined, then we will continue to utilize the Canvas platform in all grades, K through 12. And however that teacher decides to update that student for instruction, some of it may be a recording, some of it may be a live, just depending on whatever that teacher comes up with a system that works best for their students, both in the classroom and that's being quarantined. So they will not automatically become a BVA teacher and be rolled to a different classroom or a different instructor. They will remain under the instructional guidance of that classroom teacher.
Teacher letters went out last week. There was information in there about open house, but open house is coming up for most next week.
Yes, that's right. It'll be happening on August 12th from 1 to 7, and those are being done through either appointment or small groups. And so we look forward to being able to create as much individualized time for both the families and the students.
And Dr. Long, we want to add that if you are in grades 6 through 12, your advisor will be should be contacting you Monday to set up an appointment for open house. And K5, we sent home the letters.
That's right.
For anyone curious if the start of school will be pushed like it was last year, the chance of that is 0 to none.
That's the latest information I've received. Of course, anything, could happen, but I don't anticipate the start of school to move. I feel like that, in fact, the governor was asked of that question, and it's not something that, is being considered.
We're waiting to see if we have any other questions that come through Facebook at this time. Dr. Long, anything specific you would like to address with your parents or your teachers? Sports is being asked a little bit. I mean, sports is going to go forward as scheduled?
Is. So activities and sports are going forward as scheduled. Of course, we'll be asking things regarding distancing at any of these activities, but currently AAA does not have any guidelines in which we're asked to follow there. Of course, we're going to put some things there particularly recommending masks on all of those indoor activities as well.
Will you be limiting attendance to any of these?
At this time, we will not, but we will be maximizing our space at all of our activities. And so really looking at our space and making sure that we're spacing out. If you look here, we're here in Dunbar Auditorium. Of course, nobody's really in here, but every other row is marked off, and so we'll continue with those type of things at activities. So I really appreciate everybody tuning in with us tonight. If there are any questions or if anything does come up, there is a frequently asked questions document on our website. There's a link that has been posted out there on Facebook. And so also just give us a call if you do have anything in addition. So appreciate your help, appreciate your support, ask for prayers and encouragement, and we're going to hope and pray for a great start of school. Thank you all.